Hello and welcome back to another informational video on epilepsy. If you haven't already, do take the time to check out our previous videos on more information about epilepsy and seizures. In this video, we are talking about the various treatments that are available for treating epilepsy. Seizure treatment is very specific to the type of epilepsy you have and the symptoms that are experienced. Some treatment options include surgery, drug therapy, neurostimulation devices, dietary therapy, and complementary therapies. Although seizures can be minimized to complete seizure freedom with various treatment methods, the only cure for epilepsy is surgery. Patients may be considered for surgery if they have drug-resistant seizures and the seizure activity is identified as originating in a specific area that can be removed without causing adverse side effects. The area needing to be removed can range from a small lesion to an entire hemisphere of the brain. Further testing may be done to evaluate eligibility and prepare for surgery. The most common method of treating epilepsy is drug therapy. Drug therapy is effective over 70% of the time. Different types of anti-epileptic drugs are required to treat different types of seizures. Usually, one medication is prescribed for seizure control, but a second drug may be required if the person has more than one type of seizures. Newer drugs on the market called broad-spectrum drugs may control more than one type of seizure, therefore they may be tried first. Consistency is very important for drug therapy to be as effective as it can be. Missed medication doses or interactions with some over-the-counter or herbal medications can trigger seizures, so be sure to check with your doctor and pharmacist about the possible side effects. Some common side effects to medication include drowsiness, fatigue, dizziness, nausea, poor coordination, and behavioral changes. Patients often believe intolerable side effects are an inevitable part of drug therapy, but the goal of drug therapy is to achieve seizure freedom with no side effects. It may be possible to reduce unpleasant side effects through changes in dose or medication. Neurostimulation devices are devices that apply electrical stimulation to the central nervous system to reduce seizure frequency and severity. A few examples of these treatments include the VNS device, the RNS device, and DBS therapy. These devices are primarily used to treat focal seizures and in conjunction with medications to help make drug therapy more effective. The vagus nerve stimulation device is implanted underneath the skin, usually under the collarbone area, and is wired and connected to the vagus nerve. The device is programmed to deliver electrical pulses at regular intervals. According to research, these pulses may help control seizures by increasing blood flow to promote neurotransmitter activity. A responsive neurostimulation device works much like a pacemaker. It learns the normal patterns of the individual's brain and monitors brain waves to respond to unusual activity that resembles a seizure. The device or neurostimulator is implanted in the skull and tiny wires or LEDs are placed in one or two places on top of the brain where the seizure activity may begin. A deep brain stimulation device involves implanted electrodes within precise areas of the brain that are attached to a neurostimulator device implanted under the skin in the chest or abdomen. This device is programmed by a doctor or nurse to deliver shocks in a preset cycle. The electrical stimulation provided by this device is meant to reduce seizure frequency, much like the VNS device. The DBS device can also collect and report data from the brain to help make other treatment decisions. Dietary therapies are used for those with drug-resistant epilepsy, some in conjunction with medication. There are 4 major types of dietary therapies available for treating epilepsy, which include the ketogenic diet, medium-chain triglyceride diet, modified Atkins diet, and the low glycemic index treatment. These restrictive diets involve a very low carbohydrate intake and a high fat intake. The type of dietary therapy will be dependent on the specific type of epilepsy and the patient's needs. Due to the very specific nature and goal of these diets, they are planned and closely monitored by a dietitian and neurologist when prescribed. Dietary therapies can have adverse effects if not properly used under the guidance of your medical team. There are also a number of complementary therapies that are available and have been anecdotally reported to help some people. These therapies have not yet been scientifically proven and include aromatherapy, biofeedback, acupuncture, yoga, relaxation and massage therapy, among others. It is most important to tell your doctor if you plan on trying any of them. Any chemicals, including herbals, can affect the way anti-epileptic drugs work, and your doctor must be advised. It is best to use any therapy under the guidance of your doctor or neurologist. If you have any questions regarding epilepsy and seizures, please do reach out to us by email at educationcoordinator@esebc.ca or visit our website at www.esebc.ca. You are also welcome to reach out to us through any of our social media platforms and follow us to stay updated with our client support and education and awareness programs and events. Also, be sure to fill out our feedback form in the description. Your feedback is very much appreciated and it helps us improve our future presentations. Thanks for watching and stay tuned for our next video.